Hi there. And how are you today? All ready for your operation? Great. Well, let me start by saying there's absolutely no need to worry today. You're in the very best of hands, okay? What we're going to do to start is I have a little pre-op questionnaire here with lots of health questions just to make sure I've all the information that I need before we head on through, and then a few pre-op tests, so just things like blood pressure, temperature, things like that, so we know that you're absolutely fine to go ahead. What we'll do then is we'll talk through exactly what's going to happen today, okay? Fantastic. So for now, just sit back and relax, and we'll go through this questionnaire together, okay? Great. So firstly, just confirm your name for me so I know I've got the right notes here. Thank you. Can you confirm your height for me, or tell me your height please, in centimetres if possible, and your weight in kilograms please? Great. Next, I'd like a list of any current medications please, so anything that you're prescribed by your doctor, anything that you buy over the counter, anything herbal remedies, anything like that, the dose and the frequency please. Okay. Okay, thank you. That's great. Do you have any allergies? So we're thinking here about any medications, anything, penicillin, anything like that, any other drugs, foods, environmental items, anything you might come across here in the hospital today, latex or gloves, things like that. Okay. Have you had surgery before? And outside of surgeries, any hospitalisations, and if so, what were they for? And a bit of an odd question, but I have to ask it anyway. Do you know what surgery you're here for today? Can you tell me what surgery you're here for? Yes, that's right. So a little bit now about your history with anaesthesia. Have you ever had any problems with any kind of anaesthetic, either yourself or any of your relatives, please? Okay. And tying into that, any lung or breathing problems at all? Do you have a cough at the moment? Any asthma at all? Any kind of respiratory issue you're receiving treatment for? Have you had, in the last 6 weeks, a cold, any flu or any respiratory kind of infection at all in the last 6 weeks? ever been diagnosed with sleep apnea? Do you snore at all, or have you been told that you snore? Have you ever required supplemental oxygen therapy? Ever had any x-rays on the chest that have come back abnormal? Do you smoke, or have you ever smoked? And if so, how many and for how long? Are you regularly exposed to passive smoke, so smoke from others? Still thinking about those lungs, are you able to walk up 2 flights of stairs without getting out of breath? And if you had to walk a short distance, say round the block, would that be problematic? Okay. Do you find that you get short of breath at night? Ever had any heart problems, so heart murmur, any angina, chest pain, heart attacks, anything like that? Any irregular heartbeat ever? Any congestive heart failure or abnormal electrocardiograms at all? Ever had any issues with blood pressure? Too high, too low? That's great. Any kidney or bladder problems at all? And have you ever had jaundice, either now or in the past, so any yellowing of the skin? Any liver problems in general at all? Okay. And do you drink alcohol at all? And if so, how much, how often, and the last time you drank alcohol? Okay. Any stomach problems at all? Any acid reflux, hernias, ulcers, heartburn, things like that? Thinking about neurological now. Any stroke, seizures, episodes of unconsciousness or fainting, or other neurological problems? Bearing in mind why you're here today. Okay. Any numbness or weakness in the arms or legs? Frequent headaches? eye problems or any problems with your vision at all? Any hearing problems? Any diabetes or high blood sugar issues? Any thyroid problems at all? Have you had any steroids in the past year, so prednisone, anything like that? Any back or neck problems at all? Do you suffer from arthritis? Any other physical disabilities? Thinking about the blood now. Do you bleed easily? Have you taken any anticoagulants, so any blood thinners, in the past month at all? Have you ever suffered from anemia? Have you ever been anemic? Have you ever been evaluated for sickle cell anemia? Okay, almost there. Thinking about your airways now. So, your teeth. Do you have any chipped or loose teeth, or do you wear dentures? Any caps, any bridge work? Any problems opening your mouth at all? Any problems with your jaw? With previous anaesthesia, have you had any airway management problems? Medications? Have you ever taken any prescribed psychiatric medications? Have you ever used any recreational drugs? And if so, when did you last use them? Okay. And finally, any other medical problems that haven't come up here that we haven't discussed that I should include on here? Fantastic, that's it. That's all the questions from me for now. I would imagine the rest of the questions will come from you. So what I'd like to do now is just a few pre-op tests, okay, just so we can make sure that you're fit and healthy to head off for your op today. What I'm going to do is have a good look in your mouth and at your throat. Be having a look at your jaw, getting you to move your head, having a listen to that chest, then taking your blood pressure and your temperature, and then randomly, I'll explain why, we're going to be showing you some pictures. Okay, but we'll get to that. Fantastic. So, what I'll do is I'll pop my clipboard down for now. I will be picking it back up and making notes as we go. I'm just going to put on a pair of gloves and then we'll start taking a look. How long has your wait been for this operation? Not too long, I hope. Okay. So what I'd like to do first is take a look around your mouth, please. What I'm going to do is just use this to hold down your tongue, and then there'll be a light. I'll just be shining around your mouth, having a look around your mouth, having a look at your teeth, and at the back of your throat, okay? If it's uncomfortable, if it becomes painful, please let me know and we'll stop, okay? Great. So, if you can open your mouth nice and wide for me. Okay, thank you. Here we go. So just starting by having a look around the mouth. Having a look at all those lovely teeth. Taking a look at the back of the throat. That's great. Thank you very much. That all looks very good. Then I'd just like to have a feel around your jaw, if that's okay. Okay, any discomfort, let me know. So open your mouth for me a little way. Close for me. It's great. While I'm here, I'm just going to have a feel of the glands under your chin. That's great. All good. What I'd like you to do next for me is just turn your head from side to side for me. So what I'm going to ask you to do is turn it to the left, back to the centre, then to the right, back to the centre for me. Okay? So in your own time and as comfortably as possible, so it doesn't have to turn to a point where it's uncomfortable. Okay, so turning your head to the left for me, please. Back to the centre. Over to the right for me, please. Back to the centre. And one more time. Over to the left. Back to the centre. To the right. Back to centre for me. Fantastic. Okay. What I'm going to do next is just using the stethoscope. I'm going to have a listen to your chest, and then I'm going to go around to your back and have a listen to those lungs as well. So, heart from the front, lungs from the back. Okay? Great. As usual, this part will be cold to begin with, but it will soon warm up. All you need to do is breathe normally for me. Okay. Ready? Okay, great. going to listen to this side first. Ready? Okay, here we go. That's great. This side next. Ready? Okay, here we go. That's great. Everything okay? Wonderful. So we're going to head around the back. Same thing. Placing this on your back at different points. And all you need to do is breathe normally for me. Okay, here we go. Continuing to breathe normally for me. That's great, and continue on breathing normally. Almost there. That's great. All done. Thank you very much. Was that okay? Fantastic. Write this down before I forget. While I'm doing that, I'd just like to take a feel of your wrist. Just take the pulse in your wrist, please. We'll use this hand, is that okay? Great. Just grab hold of that. It's going to count quickly. Continue to just breathe normally. It's all fine. That's great. Thank you very much. Blood pressure next. I'm sure you've had your blood pressure taken lots by now. What we're going to do is put the blood pressure cuff on this arm, attach you up to the machine, and take a blood pressure reading just to check everything's okay. I'd imagine it will be slightly elevated if you're a little nervous about today. We'll take the reading, see what's what, okay? So, the cuff goes over the arm. I'd like to slide your arm through for me. That's great, do that up. Is that comfortable? It will get tight in a moment. Let's attach it to the machine. All okay? Okay, here we go. We'll give that a moment. Almost there. Fantastic. Okay, let's take this back off. Great. And slide that arm out for me. Wonderful. Thank you very much. Let's make a note of those numbers. You will have a blood pressure cuff on during surgery, but it won't always be that tight. And your temperature next. You're feeling generally well though today, yes? Okay. So this one goes under your tongue. Wait for the bleep, and then we'll take a temperature reading. Okay, ready? Okay. Open wide for me. Thank you. That's great, thank you. Good, that's normal. Beautiful. Okay. Just going to take the gloves off for now. So what I'm going to do finally is show you, squeaky gloves, is show you some images. So during your surgery, when you wake up, we're going to be asking you lots and lots of questions. And some of those questions will be to identify some images. So before we ask you to do that, what I'd like to do is before the operation is to get you to identify those images so I know beforehand that you know what they are, okay? There's only a few. Fantastic. So we have two shapes and then some objects, okay? Great, we'll do the shapes first. So, do you know what this shape is? Yeah, that's right, that's a star. And this shape, do you know what this shape is? Yes, that's right, that's a square. And then a few objects. Okay, great. So, do you know what this object is? Yes, that's right, that's a pen. What about this? Do you know what this is? Yes, that's a dog. This one. Not that you see lots of these. Yes, that's a hat. Oops, two there. This one. Yes, that's an egg. This one. Yes, that's right, that's a mouse. And the final one. Yes, that's right, that's a car. Okay, so you're happy with all of those images, you're happy that you can identify them and that you know what they are. Is that right? Great, I'll just make a note. Okay. So here's what's going to happen for the rest of the day, and then after I've let you know what's going to happen, if you've got any questions, just let me know, okay? So, what will happen next is we will get you ready for surgery. We'll take you down, and before you go into the operating room, we'll administer that anaesthetic for you. So there'll be a few moments of hooking you up to various bits and pieces, some lovely, lovely oxygen, and then off to sleep. Now, as you know, and as you have discussed with your surgeon, once we've done the initial part of the operation, we will be waking you up mid-surgery, okay? But you won't be in any sort of pain, okay? It will be absolutely fine. The reason that we need you awake is because the surgeon who is operating on your brain needs to know what areas are doing what. So while you're awake, you won't see any of this. You'll be talking to me and we'll be saying a few things together. So we might be counting. We might be counting in multiples. We might be reciting the alphabet. I'll be asking you to once again name these pictures that you've seen, just so we know when we're looking at areas of the brain that are affecting those things and areas of the brain that are safe to operate on. Once he's done all that, back to sleep for you, the rest of the operation, and then you'll wake up and it will all be done. Okay. Any questions for me at all? Yeah, as I say, you'll be absolutely pain-free when you wake up. You won't be able to see anything that's going on, but you'll be able to speak to anybody around you if you like. But it will mainly just be me. You can focus on me. And as I say, as soon as we've got these readings, back off into that lovely sleep, okay? Fantastic. Well, if there's no more questions, what we'll do is we'll get you ready, and then I will see you next to give you that anaesthetic, okay? Fantastic. I will leave you to get ready, and I will see you shortly. Okay. Any more questions before we get started? Can you hear me okay? Yeah. Any questions? What we'll do is the final checks now, and then we'll get you off into a nice deep sleep. Surgeon will do what he needs to do, and once he's ready, we'll wake you back up. And then you and I can go through all those lovely counting and word tests together. Okay? Wonderful. Right, let's get going. What I'm going to do first is I've got some electrodes here which I need to attach to your chest just so that we can monitor you throughout. Is that okay? Fantastic. It's down here. There's 8 to put on. Ready? Okay. They're very sticky, so they will stay in place. Here we go. That's the first one. Is that okay? I know it's not very nice. So, next. Okay. Down a little bit on this side. Okay. Yeah, that's 2. Again on this side. Fantastic. Finally. Okay. Put that down there for now. Same again. Put that over there. 4 more this side. This way. Just have to make sure I don't get them stuck to my gloves. It happens. Perfect. Is that okay? Yep. Third one. And the last one. It's around here, okay? Fantastic. They all okay? Good. You need to hook you up to anything. They'll start sending readings to all of our machines shortly, okay? Next, what I'd like to do is just put a blood pressure cuff on you that will stay on you throughout the operation and take intermittent readings. So as I see, you've got your line and your cannula in this arm. We'll pop it onto this arm. Is that okay? Great. It won't take any readings now, but it will start as we go. But you won't hear it. You'll be fast asleep. So this arm. Slip this into here. Okay. Wonderful. That's great. And then I'll just tuck this in so it's not in your way. Next, on this hand, just a pulse oximeter. You don't need to worry about this. Just on your finger for me. Yeah. It just goes on. There's no needles or anything, it just clips on like that. Okay. Great. So, time to go to sleep. What I'm going to do is pop a mask over your mouth that contains oxygen. I just want you to take some fabulous deep breaths for me. Once we've done that, it's time for the anaesthetic and you'll find yourself dropping off to sleep. Okay? Okay, so let's have some lovely deep breaths to start with, okay? So, deep breaths for me. Fantastic. Carry on like that for me, doing really, really well. Feeling okay? Good. Don't be worried, as I say, you're in the very best hands today. You will be looked after like you've never been looked after before. Keep taking those lovely, deep breaths for me. Well done. A couple more for me. You may start to feel a little giddy, that's absolutely fine. Fantastic. Okay. This will go into your line. No more needles. And once this goes in, we'll pop the mask back on and we'll count down from 10 together. And we'll see how far you get. And the next thing you know, we'll be waking you up in theatre. You won't be in any pain at all. It'll be me that you see next, okay? Great, let's put this in. And it goes. Fantastic. Right. The counting bit. Let's hear you then. Counting down from 10 for me. 10. 9. 8. 7. 6. 5. 4. 3. 2. Right there. Welcome back. Just give you a minute to just get nice and awake and alert, keeping that head nice and still for me. How are you feeling, okay? some nice deep breaths for me. Any pain at all? Okay, just ignore absolutely everything that's going on around you, and we'll pretend like it's just me and you, okay? Firstly, to let you know it's all going really, really well, okay? So we're at the point now where the surgeon needs to be just applying some current to those areas of the brain. And what we're going to do is we're going to be counting up and down, saying letters of the alphabet, and identifying those pictures, if you remember those pictures, just so he knows which parts to then operate on once you're back soundly asleep. Is that okay? Fantastic. Just to let you know, this won't be painful in any way at all. If anything changes as we're going, you start to feel a little different, you're not happy, then please just let me know and we can sort that for you. Okay. Great. So, before we start, let's have some more deep breaths. Okay. Go in through the nose and out through the mouth, so we're nice and calm. Great. So, deep breath in and out. Deep breath in and out. Wonderful. One more time. Deep breath in and out. Feeling okay? Wonderful. Okay, so I think we're about ready to start. So are you okay to begin with, to count all the way from 1 to 10 for me? Yeah, we can count together. That's absolutely no problem at all. So ready? From 1 to 10, here we go. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Fantastic. Well done. Didn't feel anything? No? Okay. What we'll do is we'll carry on with these things and we'll let the surgeon carry on poking around. So this time, back from 10 to 1. Ready? We can count together again. So, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great, well done. I'm sorry if I keep looking, just looking for signals from the surgeon, but everything's absolutely fine, okay? Wonderful. So what we're going to do now is we're going to count from 1 to 10 again, then from 10 to 1, and then I think we might start some multiples of 2, but we'll see how we go, okay? So ready again? I think we're ready. Yeah. So 1, 2, 3, 4, 5, 6, 7, 9, 10. Okay. Okay, so we're interested in just counting backwards again. This is absolutely fine. So 10 to 1. Ready? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Well done. Yeah, all good. This time we're going to count up in twos. So we're going to go from 2 to 20. Then we'll go from 20 back down to 2. Quite complicated really, even when you're not having surgery. So, ready? Okay, here we go. So, from 2 up to 20 in twos. Ready? Okay, here we go. 2, 4, 6, 8, 10, 12, 14, 16, 18, 20. Good. Everything all right? You're doing really, really well. So from 20 back down to 2. Ready? Yeah, ready? 20, 18, 16, 14, 12, 10, 8, 6, 4, 2. Good. Well done. Everything all right? Good. How are you feeling? Okay. We're going to do the alphabet next. Only in one direction from A to Z. But that's going to take a little while. We can go nice and slowly and steadily. And what we can do is make sure the surgeon gets several areas with this one. Okay. He's busy working through different areas of the brain just to see if you're pausing at any of them, if you're able to carry on. It's all going absolutely as it should. Okay. Are you ready to try the alphabet? Great. So, with me. So, A, B, C, D, E, F, G, H, I, J, K, L, M, good, N, O, P, Q, R, S, T, U, V, W, X, Y, Z. Fantastic. Well done. Still feeling okay? Great. What I'd like to do next when we get the nod is just to take a look at these again. So these are the shapes and the objects that we looked at earlier. Is that okay? We'll do it the same way. We'll start with the shapes and then the objects. If you don't know what they are, it doesn't matter. Just say you don't know, and then when the surgeon is looking at a different area, we'll come back. Okay, so we're going to go through these twice together. Okay, wonderful. So, shapes first. Ready? Okay, so what shape is this, please? Good, well done. That's a star. Okay, what shape is this? Yeah, that's a square. Well done. Objects next. Okay. This one. Good, that's a car. This one. Yes, that's a mouse. Well done. Feeling okay? This one. Yes, that's an egg. This one. Yes, that's a hat. This one. That's right, that's a dog. And this one. Good. That's a pen. Well done. Excuse me a moment. So we're going to go through these again. You're going to look at them for slightly longer this time, as there may be one or two pauses. If it doesn't immediately come to you, don't worry, because it will. Okay, great. So the shapes again. So, what shape is this? Good, that's a square. What shape is this? Good, that's a star. Then the objects once again, still with a little pause for you. So, what object is this? Yes, that's a pen. Tell me, what's this? Yes, that's a dog. Next, tell me what this is. Great. It's a hat. This one. Yes, that's an egg. This one. Good, yes, that's a mouse. Last one. Good, yes, that's a car. Okay, how are you feeling? Yeah, all good. What we're going to do, I think, is just one more through that alphabet, and then it's back off to sleep. Okay, so A to Z one more time, nice and steady. Ready? Okay, so A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, Z. Well done. Still feeling okay? Wonderful. Let me check. Everything you need. Great. So, ready to go back to sleep. Okay. Next time you wake up, this will all be done. You'll be waking up in recovery. I'll be with you all the way, and then I'll come and see you for some post-op later. Any questions for me? Yeah, the surgeon can go ahead and do what he needs to do now, knowing that he's not going to hit any sensitive areas. Great. So, what I'd like you to do is, as before, just some lovely, big, deep breaths with this for me. Yeah, okay, here we go. Just for a moment. Some really big, deep breaths for me. Good, doing really well. Nice, deep breaths. Fantastic. Great. Almost there. Okay. So, same as before. A little more anaesthetic, just into that line. And then, before you know it, this will all be over. Okay, here we go. Just popping this in. As before, might feel a little cold. Wonderful. One more time for me. Let's just hear you one more time, counting back from 10 for me. So, together. 10, 9, 8, 7, 6, 5, 4. Hi there. Sorry to wake you. How are you feeling? Bit headachy. Okay. What I'm going to do is check over your charts, just do a few little post-op tests, and then I will leave you to go back to sleep. Okay. Fantastic. Just grab these charts and have a look. So how are you? I know the surgeons were very pleased with how it went. You did very well in recovery as well. What I'm going to do is just take a quick look at your line, just check everything's going through all right. Shouldn't be any pain at all. If I do cause any discomfort, let me know. Okay, you don't need to do anything. Taking a look. Okay, that's all good. So, down for now. What I'd like you to do for me first is just take some really deep breaths in and out for me, please. Is that okay? Yeah. So, in through the nose and out through the mouth for me. So, deep breath in and out. Good. Deep breath in for me and out. Deep breath in for me and out. One more time. Deep breath in for me and out. Fantastic. Could you rate your pain scale for me? I have bought some extra pain relief for you as I think you might need it. Thinking less about sort of where you've been stitched up and more about headaches, things like that. So, pain scale of 1 to 10, where 1 is hardly noticed and 10 is excruciating. Where are you on that scale? Okay, then let's give you this pain relief. It will take effect very quickly. So this just goes straight into the line, so no more needles for you. Will all go in, and as I say, very quickly, you'll feel the benefits, okay? Great. Let's put this in for you. You might feel it go in. Yep, all done. Tell me when that starts to work. As I say, it should be very quickly. Let's make a note here of what you've been given. And when. Okay. What I'd like you to do next with each hand is just squeeze my hand, please. Just looking at that. Strength in both sides. This side first. Yeah, so give my hand a good squeeze, please. Fantastic. Well done. And on this side again. This hand a good squeeze. Fantastic, thank you. Feeling any weaknesses in the hands, arms, legs? Great. Am I okay to take your blood pressure? Okay, what we'll do, I've got the cuff here, is I'll pop it onto this arm, because you've got your line in that one, you don't need pressure on that one. So, same as before, okay? slide this on for me. Yep. And there we go. Let's plug you in. Press the button, ready? Okay, here we go. That's great, there's not many more tests. So once again, you'll feel that cuff deflating. Wonderful. Okay, let's take that off. Dear, test after test today. Fantastic. Thank you very much. Going to vote. It's all good. Okay. Temperature again next, please. Once again, under the tongue, we wait for the beep. Might be a little elevated, but should be absolutely fine. Still within the range that we would expect. So, once again, under the tongue and waiting for the beep. Ready? Open nice and wide for me. Here we go. Fantastic. That's good. Back in there. Let's make a note. Next, and I apologise for this, I'd like you to follow my pen light with your eyes. Please, this might be a bit bright. Please tell me if it's too bright and we'll stop. Just want to make sure your eyes are doing what they're supposed to do. Okay? Fantastic. Let's show you the brightness of the light. Ready? That's how bright it's going to be. Okay with that? Great. So, all you need to do is follow the light. Okay, here we go. Good. Just keep following that light with your eyes. Great. Almost there. Okay. I'm just going to take a look at each of your eyes. I'm going to shine it quite closely. Ready? Just looking straight ahead for me this time. No need to follow the light. Ready? Okay, here we go. Good. Fantastic. Well done. And the other side. Good. Yeah, almost there. Yeah, that's it with the light. Thank you. I'd like to take a quick look just at those dressings around the head. I'm aware they will be very tender and sore. Just want to check that they look all right. I know the nurses are doing a very, very good job of keeping an eye on everything, but just to take a look. Is that okay? Okay. Just start by looking. Just okay, good. Any pain, please let me know. Okay, good. Do you remember much about talking to me during the operation? How's the pain now? You've had that extra pain relief? Great. So finally, before you head off back to sleep, just one more thing, and you'll probably be sick of these now, but I would like you to please just identify those shapes and objects for me one more time. Fantastic. Name a few objects and then sleep. Okay. So starting with the shapes again, please. Can you tell me what this shape is, please? That's right, that's a star. And this shape, please. Yes, that's right, that's a square. And then these objects for me. Yes, that's a pen. This one. Yes, that's a dog. This one. Yes, that's a hat. What about this one next? What's this object? Yes, that's an egg. Two more. Yep, that one's a mouse. And finally, very last test of the day. What is this object? That's right, it's a car. Let's make a note on here so they don't ask you again. Great. Do you have any questions for me at all? Okay. Well, I have to say, you've done absolutely brilliantly today. It has been a long day. So all that is left now is for you to go to sleep. The nurses are on hand if you need anything. The surgeons will be back to see you tomorrow, as will I. But for now, like I say, off to sleep.